So I'm starting this talk by actually giving you my conclusions. These are the sort of the take-home messages, and they may not be completely clear, right off the bat, but hopefully after the end of my talk, they will become more apparent. So the first is that child nutrition is not just a food issue. And of course, food is important and crucial, and food security and those sorts of issues we need to think about. But I'm going to, in this talk, really kind of go beyond food and talk about all the other things that have to happen for children to flourish and be well nourished. And the second take-home message is that children's nutrition will only improve with multi-sectoral efforts. Okay, and we'll dig into all that a bit with this talk. So I'm not sure how much you're familiar with this tracking of child nutrition through growth monitoring. But I'm going to give a very brief description of it. And feel free to ask me questions as I go along. That's no problem if there's anything that's confusing. Happy to be interrupted. There are multiple ways to track child malnutrition, but one of the most common ways to do it, it's sort of the simplest and most cost-effective way, is to use growth monitoring. And often the sort of the three data points that are most often collected are height, weight, and age. And with this growth monitoring, this can be collected for different countries and compared all around the world. So one thing that growth monitoring can pick up is growth failure. And growth failure is very common in many low-income countries around the world, developing countries, if you prefer that term. And it is really something that happens within the first 1,000 days of life. So you might have heard this phrase, the first 1,000 days, and this is referring to conception. So it's including pregnancy, and then up to about the age of 2 years. And what happens with growth failure is that it's happening in this sort of early period. And by about 5 years of age, you can see the results of early growth failure in the form of what's called low weight for age and low height for age. So here I've got a graph showing how growth monitoring is charted. And so you see here, this is weight for age, but this could also be height for age. And basically what it is it shows in the green the WHO, World Health Organization, reference standards for healthy growth of children. And this is plotted here with what are called Z-scores. And don't worry about the sort of technicalities of this, but what you have to kind of just see here is that children grow in sort of if you're looking at like this is thousands and thousands of children plotted here. They grow with sort of, around sort of an average. In this case, it's weight, but it could be height. And then there's kids who are at the lower end of that spectrum and those at the higher end. And this is what the World Health Organization has measured healthy children to look at what that looks like. When you're going into a low-income country and you're studying a group of children, in this case, this would be 96 children that have been measured and plotted, you're often going to see that this growth curve is shifting down so that the average kind of weight or height for age is lower than this WHO reference, okay? And so the kids below what's usually -2 standard deviations below the mean or average these kids are considered to be in danger, okay, that they're experiencing some kind of growth failure. And so just to show you what that can look like in these drawings, this would be a child of normal weight and height. So normal, so somewhere within this growth curve here, the green one. And then this child has very low weight compared to their height. So they're very thin. It's also often called wasted. And this is something you would see in a kind of a famine situation or some kind of acute short-term malnutrition stress. What I'm going to talk about today are children that they're called stunted, which means that they're shorter than normal. So they're not very thin like this child, but they're shorter than they should be for their age. And this is often a result of this kind of growth failure that's happening chronically. So kids are getting enough protein and energy, but they're not getting and they're getting, I should say, sufficient amounts to sort of keep growing and not be in this kind of wasted situation, but they are not thriving. They're not getting enough of the protein and energy, and they're not often getting the vitamins and minerals that they require to have healthy growth. And of course, this situation here where you're seeing wasted and stunted children is really extreme. So this is long-term growth failure plus very extreme conditions, often experienced in sort of famine, war-torn situations where war is existing. So, so that's just very kind of a quick review of stunting and or monitoring growth. And then again, to focus on stunting, we're talking about low height for age. So this picture shows you kids from Guatemala. And while they look fairly healthy, what we're seeing is that they're much shorter than what the WHO reference point would be for kids growing around 9 years, growing at the age of 9. So these children, as I said, might look healthy, but they can actually suffer from severe, irreversible physical and cognitive damage. So it's that through that process of growth stunting that their bodies and brains are not developing optimally. And this can have quite, detrimental effects through both in childhood, partly because their immune systems are also not functioning as well as they should be. And that makes it difficult for them to fight off diseases. But it can even just lead throughout their lives, giving them, chronic health issues throughout their lives. And then this can go into the next generation, right? So think about this intergenerational, exchange, progression of malnutrition where women who are malnourished are giving birth to children who will be malnourished as well. So this is what stunting looks like across the world. This is data that's been collected from UNICEF and the World Health Organization and others. And basically it gives you just something that I'm sure you're all familiar with, where, the hot spots of malnutrition. So the pink is that very high. So more than 30% of children under 5 years of age are affected by stunting. And the hotspots in the world are in Africa and in Southeast Asia and Southeast Asia. And I know your group does a lot of focus on Africa, but obviously this is a concern in South Asia and Southeast Asia. Some have even said this is a bit of an enigma in South Asia and Southeast Asia because India, for example, as you probably know, is developing very rapidly economically, and yet there is still as much, and actually, if not more, in terms of the geographical spread of stunting occurring in these areas of South Asia and Southeast Asia. And that's probably because of the economic inequality, right? So people are getting very rich here. There's a growing middle class, but there's a lot of poverty still in these regions. So as I'm sure you're all familiar with the United Nations Sustainable Development Goals, goal number 2 is zero hunger. And that would then follow from that when we're talking about zero hunger, that we would like to see close to zero stunting in the world. And the good news is that stunting has really declined since the year 2000. So since the new millennium, we've seen this really great decrease in stunting. So this graph here shows you, this is again for the whole world, that in 2000, about 33% of children were stunted. And in 2022, we see that it's gone down to 22%. Now, that's still not fast enough to make that target of 2030 that the United Nations has set, but it is progressed. Unfortunately, the wasting that I talked about, which is that acute malnutrition here shown in the red, has come down a little bit, but we're still seeing that's like persistently stubborn. And again, that's like the most acute kind of malnutrition. But again, we don't want to discount stunting, because this is that kind of chronic malnutrition that's there, but it's not necessarily getting as much attention as when we see children who are wasted and enduring acute malnutrition. And I won't talk about this much in this talk, but you see that blue is overweight, and that is actually, as we know, going up. And it's not just going up in high income countries. I think we associate overweight with high income countries, but indeed, what we can see sometimes is children who can be both stunted and overweight in low-income countries. And that's called the dual burden of malnutrition, which could be a whole other talk, but I won't get too much into that. This one just is showing you the number of children in millions under 5 who are affected by stunting, wasting, and overweight. And again, we see these decreases, especially in stunting. So that's a good news story, which we don't always hear about. This is a rather complicated chart, and I don't want you to worry about too much of the details, but I want to just, before I start talking specifically about Nepal as a case study, I wanted to just talk a little bit more about what the determinants of stunting are. So what causes stunting? So number 1 factor is low birth weight. So children who are born with low birth weight obviously have a bad start, right? In terms of that growth that they're going to be doing, that rapid growth up to 5 years of age. And that is connected with maternal characteristics. So the nutritional status of the mother, as I mentioned earlier, is going to obviously have effect on her child. So we're thinking about that intergenerational piece there. So those are sort of immediate causes. And then what's driving low birth weight is obviously inadequate dietary intake. And that's going to be just children not getting enough and the diversity of foods they need for good, healthy growth. But again, something else, this talk is focusing on more than just food. So disease plays a huge role in child stunting and malnutrition. Many and I'll give you kind of more a little bit more about that in the Nepal case study, but many children in low income countries are suffering from chronic diarrhea, and also acute respiratory infections. And those are things that are going to divert energy away from child growth, and they're going to, because the child is just trying to fight the disease. If it's a respiratory infection, if it's diarrhea, it can also cause appetite suppression and that sort of thing. And so the child is, even if the child has enough food, they may not eat it because they're often sick. Okay, so these are sort of the immediate causes. And then what are the underlying causes of these things? Again, oh, sorry, I thought I had another circle to go, so I'll just use my pointer here. Again, related to diet is inadequate feeding practices and food insecurity, and that could be related to early child feeding, breastfeeding, and complementary feeding, like when the child is weaning. But there are all these other things to consider as well. So healthcare services, really important for healthy child growth. And what's the household environment like? And I would actually expand that beyond the household and say, what's the community environment like? Again, if the sanitation and the water is not good, then that's going to lead to this disease problem, particularly again related to parasites and diarrheal diseases. So things like it mentions urbanization, and it's not always just urban environments, because rural environments can have these problems as well. But with urbanization, you do sometimes get this more crowding going on, and that will cause, might mean not having clean water. Open defecation is a real problem, which I'll talk about in the case study of Nepal in a minute. And and also the crowding, so not having adequate shelter and crowding, which again can lead to disease situation. And then if we go down to the basic causes, what kind of programs are happening? This particular chart was actually designed to talk about Peru, a Peruvian case study, but this chart applies to all low-income countries. So what kind of programs are in place to help support children's nutrition? And then some of the basic causes. So what are the socioeconomic factors? And there's all sorts of ways to measure wealth and poverty and that sort of thing. One thing, though, that we have to remember is the Gini coefficient, and that's basically a measure of income inequality. So again, when I talk about, say, South Asia, which I mentioned earlier, they're doing well. They're rapidly, developing economically, but what's going on with the income inequality within those nations in South Asia? And then also things like education. And then the bottom one, I don't know if you can see that, but that's the macro social, economic, political, sort of global economic and political factors that are, affecting people living in low-income countries, like war and, whether they have democracy and that sort of thing. Okay, so that's just sort of a primer on stunting as a measure of chronic malnutrition. And now I just want to talk specifically about Nepal, and I don't know how familiar you are with Nepal, so I'll just give you some basic sort of facts about the country. So this is a map of Nepal, and it's this tiny landlocked country, which is between two big superpowers, China and India. And it's, if you've heard of Nepal, you probably have heard of, the Himalayas, and the mountains where people go trekking. This is all in the north of the country. And then the capital city is Kathmandu. And then the lower part actually is the southern part is borders onto India, is actually not high altitude. It's actually like plains, very flat, very hot. So it's got an amazing diverse geography with Mount Everest, being, one of the tallest mountain in the world. And then it's got this really diverse group of people living in this country where they're, very different religions. Hinduism, Buddhism are the main two religions in the country. You've got sort of the influence of Tibetan people that have moved to Nepal in the north, and then you've got sort of more people that are more kind of ethnically connected to Indians. Incredible multicultural, many languages spoken. We are challenged by French and English in Canada, but they're speaking multiple languages. Nepali being the kind of the common language that they all speak as their for government and official reasons in school. Nepal endured a civil war from 1996 to 2006. It wasn't it was obviously no war is good, but it wasn't a terrible war in that it didn't devastate the country. It was just sort of more of a Maoist insurgency that was happening in sort of remote parts of the country. Nevertheless, it was unsettled for about 10 years. And it is now a democracy after that war ended in 2006. It's a parliamentary democracy. They did have a royal government, a king, and the king was overthrown in 2006. So they now just have a prime minister. So they have a more or less working democracy. And I just should point out too, it is one of the poorest countries in the world by gross national income or gross domestic product measures. It's unlike its neighbors like Bangladesh, Pakistan, and India, and China, for that matter. It's not growing rapidly in terms of its economic growth compared to these other nations. So I just share with you a few photos that I took when I was working. I did research in Nepal in the 1990s. And I was working just outside of the capital city of Kathmandu in a place called Boda. And it was a really amazing place. And the center of Boda is this stupa, which is a religious pilgrimage site for Buddhists and Tibetan peoples, and they come to Boda. But it was also a big, thriving, rapidly urbanizing community. This is our rice fields, which are no longer there. I was in Nepal again in 2019, and they no longer have these rice fields. This became rapidly urbanized. But at the time, this was one of the few green spaces that was there. And this is sort of a more industrial landscape of what this community looked like. We call it peri-urban, being just outside of the urban Kathmandu. And was rapid construction. So these are houses that were going up all over. And again, when I was there in 2019, it had just doubled, right? This was a huge migration of people coming from rural areas to Kathmandu. This is, of course, happening all over the developing world and continues to be more and more urbanized. So I was working with an industry that was thriving in the 1990s. It was a Nepali carpet making industry. So they were making Tibetan type of wool carpets for export to many countries, particularly European countries. Germany were buying a lot of these carpets at the time, and it was a huge kind of industry that kind of blew up in the 1990s, and that it just expanded enormously. And what I was interested in was all of these families who were moving from their rural villages to Kathmandu to work as either weavers or spinners, wool spinners. And so there were those kinds of weaving halls where people were working in sort of more factory-like conditions. And then they would even have these little small, all over, you'd see these almost like little garages where they'd set up looms and spinning wheels, and people would be hired to work in this industry. And they were, as I said, primarily young people who were forming families. So what I was looking at was what was happening for these children under 5 years of age. Their parents have come to do this weaving and come from villages to the city, and what's happening with this new environment in terms of the growth of their children. So my study was focused on children from birth to 5 years of age whose parents were employed in the carpet making industry. And I did a number of things, but I'm just going to talk to you about the growth monitoring findings that I found. This just took place in 1995 and 1996. And what I did was I tracked 283 children under 5 years of age. I measured them all 3 times in a year. Okay, so I was able to look at what's happening now and then what happened over the course of 1 year of their lives. And what I found was that 50% of children from 6 to 36 months of age were stunting as compared to the WHO reference standards. And that between 36 or 3 years of age and 5 years of age, they were 78% of these children were stunted. So that is one of the highest levels of stunting in the world. So Nepal was experiencing this. So these kids were, experiencing this kind of early growth failure. And my findings were not out of line with what the national data collection was showing, that the things were not good for these kids. And like I said, this is a chronic growth failure, and it was very common for these children. Yeah, so this is showing you the data of kids, these 283 kids plotted against these height. So this is height or length. If kids are under 2 years of age, we're going to look at length. And the blue was the Nepali data, and these dotted lines are the World Health Organization data. So these are kids, like 5% of kids are growing sort of each month, they're growing this much in height. And this is what's happening at 50%, 50th percentile are growing like that. And what I saw for, this is both for girls and boys, that even if kids started out sort of at the 50th, which is around the average for the healthy kids in the world, they by about 8 months, they'd gone down to the 5th percentile. And then by 18 months and beyond, they were way below that 5th percentile. So they were experiencing that growth failure. And a major contributor to this stunting was parasites. So this is where I'm going to get back to the environment. What was going on in these kids' environment? Well, we did do stool tests with these kids. We collected their stools and looked for parasites. And these were the kinds of species of parasites that were found very commonly in their stools. And this, I don't want to get into this too much, but again, pointing out that these parasites are causing chronic diarrhea, Their appetites are being suppressed, and this is leading to under-eating and undernutrition. And so this is, all part of what's going on and contributing to that growth stunting. So this is some Nepal. The good news is, so that's the 1990s when I was doing my research. So the good news is that Nepal has been considered to be an exemplar in reducing child nutrition. And this plot just shows you the gross domestic product. So it has been going up since the 1990s. And this is showing you the stunting, which is going down quite rapidly, mirroring what I showed you at the beginning, which was the decrease in stunting worldwide. But Nepal started higher, so somewhere just over like 60% of kids in 1995. And there's been like a huge decrease here. I can actually just show you. This is an interesting website, by the way, if you ever want to look at it for all countries. This is not just Nepal. So they show you here how you can take this, and here we are in 2000, just around 60% for Nepal. And then we see this decrease right down to today, 27%, 26.7% for Nepal. It shows you a few other countries by comparison. But it's pretty impressive what happened there. And so I want to now just turn to talk about, how did this happen? And I'm referring here to a study that was done by Cunningham and colleagues who looked at, analyzed all this stunting data from 1990s to 2010s. And they figured out what were the four main factors that decreased stunting. And they called what was going on in Nepal an enabling environment. And that was because of multi-sectoral efforts to make this happen. So first of all, Nepal, and I should say this was happening, the Nepali government was working with international non-governmental organizations and non-governmental organizations in Nepal as well, right? So all of these different forces were working together to make things happen. So first thing they did, focused antenatal, or prenatal maternal care. And they started a whole program of female community health volunteers. They mobilized these volunteers in villages all over Nepal who went out and really helped women who didn't have access to formal health care. And so they were doing primary health care with women to help them with their pregnancies and the care of their children afterwards. Increased public expenditure and education. So focus on primary education. Many Nepali people in the 1990s, when I was there, were not getting access to education. It was the elites, people who could pay for the education, private schools, that sort of thing. And so from the 1990s, from about 2000 on, they made a real effort to improve literacy and get people educated. So we're not talking about, educating about how to like feed your kids or, focus education. We're talking about just primary education. And of course that included girls. Water, sanitation, and hygiene. This is often short formed as WASH. Really important, again, if you're thinking back about the diseases and the environment and how that really is problematic for children's nutritional health. So one of the big problems in Nepal, and I saw it all the time when I was there, was open defecation. So people don't have access to toilets, either in rural villages or even where I was working just outside of the city. And when you have open defecation, you have problems, right, with parasites and so forth. So big promotion of community-led construction of toilets. made a huge difference. And then the last factor was decline in poverty rates. And so from 1995 to 2010, poverty rates declined from 68% to 25%. That's huge. And that is one of the leading reasons why child stunting decreased as well. So how did they do that? Well, one of the big factors was Nepalis working outside of the country and sending home remittances. So many Nepalis continue to work in the Gulf states. And they work there often in construction. Some of them work, women work as nannies, and they send their wages home to their families. And this is also going on. Some Nepali people are going to North America. Some people are going to India, and they're working low menial jobs, but they're sending their money home. And what happened with that is households were able to grow in wealth, and they were able to invest in the economy in Nepal. Growth in agriculture. So agriculture is one of Nepal's important economic development industry. I don't know if you want to call it industry, but it makes money for the country with exports. And so the government, again, and INGOs invested in improving agricultural output. Not only does that create food, but it creates wealth. And then finally, after 2006, once the Civil War ended, we saw a big growth in tourism again in Nepal, which again helped the economy and helped people to get out of poverty. So those basically come back, what I've told you now comes back to those take-home messages that I mentioned at the beginning. Child malnutrition is not just a food issue, right? It has to be, it's multifactorial, and children's nutritional status will only improve with multi-sectoral efforts. So that's different groups, civil society working together to make those improvements. And that's it. Any questions?
Hi, yes, I've been monitoring questions, Tina, and we had a couple. At the very outset, someone asked for a bit more explanation on how the WHO reference point for normal and stunting is developed. Is there, there are variations around the world, variations between boys and girls. Just could you expand on that a bit?
Yeah, no, it's a great question. So the World Health Organization in about 2006 developed kind of redid their reference standards for kids from birth to 36 months of age. And the reason they did that is because the previous growth references that they'd been using were from really just from United States, because the United States had been doing has been doing these big studies for a long time. So that was really where the data was coming from. But one of the problems they realized was that the data that was collected in the United States, a lot of the women weren't actually breastfeeding. So there's a lot of bottle feeding going on. Formula feeding tends to make kids a little bit bigger. They grow a bit faster. And so the World Health Organization realized that it needed to go to only include breastfed kids. And then it went to sort of 5 different countries, and I can't remember the exact countries, but some of them were sort of high income, like Norway. And then there were others, more low income countries. When they went to the low income countries, they made sure they found kids who were in, families, households where they had enough food, that they weren't impoverished. So they were getting sort of the best growth they could find in these low income countries, and then looking at the same for the higher income countries in terms of making sure the kids didn't have any kind of health problems or whatever. So it was trying to approximate like the healthiest growth possible in the best conditions.
Mm-hmm.
So that's where that standard comes from.
That's really helpful. Thanks for that explanation.
Yeah.
Tina asked about something in your slides. You include altitude as a cause of stunting. Can you expand on that a bit?
I didn't include that as a
Oh,
cause of stunting. I'm just trying to think where that would be. Was it this diagram that I showed at the beginning?
I'm, yeah, it might be. I didn't notice it. It was Tina who pointed it out.
Okay, well, certainly, I mean, it's an interesting question because high altitude, um, it was thought for a long time that maybe high altitude might cause stunting because people at high altitude have lower like oxygen, right? You experience hypoxia, especially if you're at very high altitude. But even where some Nepali people live, it's quite high. But it's been found actually that humans are pretty amazing. People living at high altitude have actually adapted to those hypoxic conditions. And so the growth is not really that much different. They grow a little bit different, like their lungs are actually enlarged to deal with the high altitude. But generally, any growth stunting that's going on at high altitude is usually more due to like lack of, back to this diagram, lack of good nutrition, disease, those sorts of things.
Yeah.
And not everyone in Nepal lives at high altitude. Like Kathmandu is actually in a valley, which is surrounded by the mountains. So
Okay.
it's varies.
Tina did see on your slide, and it's the one you have up here, in the middle columns underlying causes, the left hand, the last bullet says altitude right underneath complementary funding, or complementary feeding, sorry.
Oh yeah.
Yeah,
Okay.
This is Ruth. I just
You know
wonder,
what? Wow, you've got good eyes. It actually could be attitude too, um, and that might be a misspelling in that.
okay.
Although it's possible because this is Peruvian. This was taken from Peru, so um, they have the Andes there, so it's possible.
Okay.
Yeah,
Tina, did you want to stop screen sharing now so we can
sure.
see, or I'm not sure. I have just a couple more points that people made that I just wanted to raise. Phyllis makes, I think, a really good point here. It's really not so much a question, but it'd be great to get your comment on it. She said cultural attitudes toward food are also an important issue. In some cultures, boys and men eat first, and then the females in the family get to eat. Do you have a comment or thought about that?
Yeah, yeah. So Nepal's really interesting in that there are different kind of cultural and religious approaches um, to gender and also to eating. So within Hinduism, there is definitely women will often serve their family first and then eat later. And there may be some more sort of inequality between men and women in that cultural context. There are many people in Nepal, though, who are not Hindu, and they tend to have a little bit more gender equality. If in Buddhist type of ethnicities where they don't have this kind of eating last, and they have women tend to have a bit more kind of autonomy in the Buddhist ethnic groups. So that's a bit of a generalization, but certainly Nepal, has probably changed a lot, and that may be one of the factors that should have been included in the decrease in stunting is that with women getting more education and more access to income earning, they have had more autonomy, more empowerment, and that is always going to be helpful for the children, right? In terms of what they can do to direct more household income, for example, towards children's food and healthcare.
Yeah, thanks. That's helpful. And we've certainly seen in some of the other research we've come across that gender-based inequalities really do make a difference for maternal health, children's health, etc. So, and Tina added another thing, just she said she asked the question about altitude because she wondered whether there were hereditary factors and evolutionary adaptations that contribute. So, but you've sort of answered that. We're not sure about that.
Yeah, I mean, I think one thing, whenever you talk about stunting and, oh, children are short in Nepal or they're short here or there, I think people go to that, oh, it's just a genetic differences, evolutionary differences. And I really I think that we have to be careful with that because we've seen this decrease in stunting, right? Just over like 30 years, right? And we've seen it because of improvements in the environment. So human growth is pretty plastic. Like it's not something that is set in stone through our genetics. And so we have to really be careful that we don't just think, oh, those people are short because they're short. There's obviously diversity and growth around the world. But if you look at, some African, I showed you the stunting in Africa, right? So we tend to sort of think of, tall people coming from Africa, and yet they have, like Southeast Asia, and South Asia, some of the highest stunting in the world. So I think it's really, it's hard for us at this moment of time because we see the world in a certain way, but let's fast forward in 100 years and see what's happened. Let's hope some of this income inequality and this access to resources has changed. I mean, that's what we're working towards, right, with these Millennium Goals.
Yes, that's right. Okay, I think that's pretty much it for questions. I'm really glad people raised the questions they did because it did bring out some other interesting aspects. And one of our members also said that when her husband traveled to Nepal, he brought back beautiful homemade gifts and hoping that would help the economy. So you said that tourism was an important factor.
Absolutely. Yeah. Yeah.
Okay, well, I think what I'll do now, if that's all right, is I will hand it back to Ruth, who can unmute herself and say our thanks.
Tina, my head's full and I took notes, so I learned a lot today. I really appreciated the primer on stunting, and learning more about Nepal was really fascinating for me because I didn't know much about the country, and it's things are percolating in my mind, lots more questions about stunting. We focused on how it's measured, and I think Grans, we've covered this before, but just the lifelong consequences to not just that individual, but to their society, what they can contribute if their cognitive level is not what it could have been if they'd received the nutrition that they needed. So it was just hard. It was good to see that graph that stunting is improving at the rate it is, and that this is something that the world is taking action on. So thank you. Grands love learning. So, and it gives us, it's not just the learning, but it gives us more confidence when we speak to MPs or try to advocate for changes. So you've given us more confidence when we go to speak about these issues. So thank you so much for being with us today.
Oh, you're most welcome. They were great questions. Thank you. And also, I just applaud you for doing all the great work you're doing, right? This is all of us need to work together to to try to achieve these sustainable development goals. So that's wonderful.
I do have one question for you, if we
Mhm.
can, before you go, is what are you working on right now? What's your research right now, and what's ahead for you in your work?
Yeah, thanks. I'm actually working on a Canadian project right now. Some of you may have heard that the federal government announced a national school food policy and has put money towards a national school food program. And so far, 4 provinces have signed on. So I'm actually working with some researchers across the country to make sure that that gets implemented in a really equitable and just way. We want to make sure that kids in Canada are getting access to good, healthy food in school. As you all know, there's been a cost of living crisis, and children's, a lot of kids living in food insecurity in Canada, which shouldn't be in such a wealthy country. So we're very excited about making sure that there's more access to food for all kids, and healthy food. And so that's my project for the next few years.
That's
Is-
great. Good to hear.
I'm just curious, one of those places, is it Nunavut?
Yes, I believe so. To be honest, I've been focused on, I know it's Ontario. I'm trying to think of the other ones. Newfoundland signed on, and is Nunavut the 4th? Or
I just haven't, my niece left for Nunavut yesterday. She's part of a group of multidisciplinary people going into villages all over Nunavut.
Nunavut, and they have signed on. They've got commitment of money with the federal.
Well, it's part of a group of disciplines. She's with she does mental health, but
Oh,
I was
okay.
just curious.
The situation is not my area of expertise, so I don't know a lot about it, but I do know that the food insecurity situation in Nunavut is definitely at a crisis level. And they have actually been working, they have already implemented school food programs there, which is great. And so yeah, absolutely needed, and more of it's needed. The provinces that haven't really done much in terms of school food include Ontario, and well, all of the provinces really, but yeah, Nunavut is definitely in need of a school food program.
Yeah, and she's been up back and forth for 12 years, and
Yeah,
always part of her luggage was always food.
right. Oh,
The
yeah.
cost.
Oh, yeah. The cost of food is unbelievable. Unbelievable. Yeah, I mean that is again, if we want to think about, what's going on in Canada, it's really a shame. We should be ashamed of what happens in the northern territories, because the cost of food is incredible and food insecurity is really a problem.
Well, we're going to hope that food or food for children in schools in Canada becomes fully implemented. We hope that it does for sure, because it's needed.
Yes, I mean, this is where the next election
Yeah.
is going to make a difference, the
Yeah.
federal election. I pray that if another party gets in, they will not take that program away as a cost, saving measure, because that would be a real shame when we've gotten this far with it.
I'm going to give another plug for your book, Tina, because there's a chapter on school feeding programs. So if anybody's interested, she talks about how it's not just a family that feeds a child. It's a whole community.
Yeah, I love
Yeah,
that.
it takes a village, right?
Yeah.
It takes a village.
So thank you, Tina. My thanks. And I also want to thank all of the grants who came to the meeting, and appreciate all the good questions and the great attention. So thank you all very, very much. And we'll see you again soon.
All right, thank you. Take care.
Thanks, Tina.
Thank you very much. Yeah.